My name is Rene Manuel. I am from New Brunswick, Canada, and I'm speaking to you from the clinic in Vancouver after a year's treatment. So, I have been here 6 times, and this is at the end of my 6th treatment in 12 months.
So you started January 2013.
Exactly.
Now it's January 2014.
That's correct.
Yeah.
So, at first, Dr. Yu had told me that it would be at least a 12-month process. I had decided from day one that I would maximize the potential in increasing vision, meaning that I had to be here every 6 weeks to 2 months to repeat the same treatments as I did. So this is a summary from day one to a year after. So when I started, my central vision was very limited. It was limited to about 10 degrees down, well, 10 degrees almost everywhere. Central vision was good. It was always 20, 25 from day one, and it is still the same today. That did not change. I've never had a big issue in central vision. It was more peripheral like most people. The difference in peripheral is kind of amazing when you sit down and you look at the numbers. At first, I had about 46 centimeters wide I could see, which was my central vision. Could not see beyond that. Could not see. I can see the odd light if a flashlight was given to me, so on. Today, I see the pin on the wall from side to side, 180 degrees.
Yep.
Consistently.
Yep.
I've only been able to see this during the last 2 sessions. From session 1 to session 4, I was questioning. Am I the reason for being here? Because I can only see better sometimes. I would lose it. It would be spotty. Sometimes I would do an exam, which was very frustrating at times because one time I could see at 60 degrees. The day after, I would not be able to see at 60 degrees. I would see at 80 degrees or not at all. Any improvement.
Yeah, that's the first 8 months treatment is tough. Yeah.
The first 8 months is kind of a challenge because you always, if I can summarize the way I felt, you feel like a donkey with a carrot in front of your nose, where you always want to catch that carrot because you always want to see better. You always want to see more of what you do not see.
Yeah.
It took at least 4 treatments before I kind of relaxed with the process. I kind of relaxed with the needles, with the herbs, with the fact of being here and the testing and the day-to-day. It took me a while before I really got at ease at this clinic. But the 5th and the 6th treatment, that's where I saw the most improvement. That's where I can say, oh yes, this really works. Because it did work for me. It worked for me from left to right. It increased very, very much. From almost to normal. Okay, it's shades of certain colors. It's shades of certain shapes. But I think that's going to clean up also. I still have issues top to bottom. But Dr. Yu says it should clean up with time. So I still have faith that that's going to happen because it did clean up very well from side to side. As far as going home and doing your own testing, that's fun in a way because then you can really see in your own environment if all of these sessions and treatments and so on have made a difference in your day-to-day life. And it did. It did do a big change in as far as...
What changes you felt at home, at work?
You feel more comfortable in any situation that you're at. If you're going to a new area, a restaurant, a store, anywhere, you're not looking for everything. You're not trying to focus on everything before you actually go to your final destination. You don't need to wash that wall or check if there's any lights as much as I used to. I seem to be more comfortable in a new area, in a new room, in a new scenario. So those are the main. So
How about the driving? What's the difference in driving?
driving, well, for me actually, driving was not a big issue before. I still do, and I did before I ever started here. I just still drove at night, and I drove at night all this year. But it is easier. I see more, of course. If you see a pen on a wall, it also means that you see different things. And if you're driving, you can see wider. You can see, you're much more comfortable, more at ease driving behind the wheel. So I do feel better. You feel better everywhere. You don't just feel better because you can drive.
How about night vision? And change your night vision?
No change in night vision. No. So for me, I always have lights around. No, I cannot say that it changed much for night vision. No.
How's the glare to the sunlight? Do you have trouble with that?
No, I never had too much of a problem with bright lights in rooms and so on and so forth. So it was never an issue for me.
Good.
No, it was never an issue for me. But yeah, I mean this.
So basically, your central vision is stable and good, and your field has expanded from like 10 degrees to 180 degrees left to right, and top and down vertical visual field still there's room to improve. You improve from less than 10 degrees to 40 degrees now, and so I can see you get basically 70% of your vision back, your field back. And if we can improve the vertical visual field to the normal, then you're set. Yeah. Are you happy with this year's treatment?
Very happy. I do recommend people to come in. If at all, please people, come in at least once. At least once to come in. You sit down with the doctor, go through the process, you make your own mind. Testimonials are testimonials, but you got to feel it yourself. Come on in, have a chat with the doctor, spend 2 weeks here, go through the process, then you make your own decision.
Yep, give yourself a chance.
That's what it is. Give yourself a chance. Do not, please do not come because your local doctor is saying there's nothing this guy can do. Don't believe that for not a second. When you go see your ophthalmologist, he talks to you for 5, 10, 15 minutes. To do what? Just to see where you're at with the progression. He's not giving you any help whatsoever. Here, at least there's a hope for you to come in, sit down with the doctor, spend a couple of weeks, and you'll decide yourself if it's worth it or not. But I can tell you, it did make a big difference in my life. And I'm glad I came. I'm very glad I came. And I plan on coming back periodically for as long as I have an issue. I think this is the place that's going to cure you. I am not here to give out advertising. I'm not making any money out of it. Because I'm not.
No.
I wish I was, but I'm not. But I do recommend all of you to at least come on in and at least spend one session with the doctor, and you can make your own mind.
That's right.